Now, what of a politician saying that the health service, even though it gets more money, the health service has to accept that money is tight and it needs to rethink how care it provides could provide better value for money for the taxpayer. People working in the NHS and the patients using the NHS can see examples of waste and inefficiency, says the politician. It's not good enough the NHS uses every winter crisis and every challenge it faces as an excuse to ask for more money. Now, if I were to ask you for the party that politician belonged to, you almost certainly, I would imagine, go for the Conservatives. But in this case, it's a Labour politician, it's Wes Streeting, and to remind you, Mr Streeting is the Shadow Health Secretary. And he's accusing, therefore, the NHS of using each and every winter crisis and challenge as an excuse to ask for more money. Money is tight, he says. Dr. Jacky Davis is consultant radiologist, BMA council member and founder member of Keep Our NHS Public. What would your response be to that politician? Good morning.
Good morning. Excuse me. Good morning. My response is the same as yours. I would assume that came from a Conservative politician, and it's very shocking, very disappointing that it's come from somebody who might well be looking after the NHS after the next election, and I'm afraid people are very angry and concerned about it.
Well, I think patients can get angry as well, Doctor, when they're stuck in A&E for 4, 5, 6, 7 hours, don't they?
Yes, of course they do, and it's dangerous when patients are stuck. People die in the back of ambulances at the moment. But I think what the problem is that Wes Streeting has mixed up the state that the NHS has been reduced to by 13 years of Tory underfunding and undermining with the staff who are working in it, who are absolutely doing their best. And what it sounds as though he's saying is that the staff are constantly there like Oliver, just can I have some more? When in fact the NHS has been underfunded for years. It's been, the infrastructure is crumbling. If you go, it sounds as though Wes Streeting has never been in a hospital apart from Singapore. If you go into the average A&E department,
I'm sure you're aware he's successfully battled cancer.
I do know that.
Yes,
I do know that, and
he has had medical treatment, Doctor.
Yes, of course, and I'm glad that the NHS, saw him right and that he's now on his feet. But he has. It doesn't sound as though he has followed a GP or an A&E nurse or a porter around for the day and seen what their life is like.
But why is it the equation that some would say we're giving the NHS more money than ever before in the realms of around £3 billion a week, and in many areas the service has never been so poor? Why would that be?
I think you've got to be very careful with your statistics about NHS funding. A lot of money went into the NHS during the pandemic. The government threw money at what could be counted as the NHS, excuse me.
Yeah, you're right.
And they wasted it. We've already seen they wasted billions on PPE and all the rest of it. So you have to dig quite deep to see what's being spent on the NHS. And it's years of underfunding and backlog that have reduced us to where we are.
But the budget for 23-24 is £168.8 billion, which is £3 billion a week. And regrettably, many of my listeners tell me they've never had such a poor service. So notwithstanding what you reference about the pandemic, that's not relevant to this conversation. We've never given more money, and in some areas we've never got such poor return. It's not wrong for a politician to highlight that, is it?
I think a politician needs to go away and get his figures right, and I think
what figures are wrong?
You know that there are lies, damn lies, and statistics. So you can pull figures from anywhere.
Well, respectfully, Doctor, all I've done is given you the budget, 168 billion.
Yes, but first of all, as a standalone figure, it's no good. He's very fond of citing Singapore, but in fact, Singapore is not a comprehensive health service, and people who go into that fancy hospital of his, 2/3 of them are funding it out of their own pocket. So you can park that really on one side because it's not a fair comparison. The NHS spends less per capita than many comparable systems. So it's not that we're receiving loads of money and wasting it. It's that we're dealing with years of underfunding, and it's not just about money. There's 130,000 vacancies in the NHS at the moment. You can't run a system on 130,000 vacancies.
You don't see issues of waste within the NHS?
I don't see huge issues with waste, and where there's the problem at the moment is people can't keep their heads above water. You know, we were promised more GPs, and in fact what we've got is considerably less GPs delivering more appointments. We were promised this, that and the other. We've got fewer beds than European systems, we've got fewer staff than European systems, and yet we're constantly compared with systems that are better off than we are and told we're doing badly. There's nothing the matter. What was interesting about Singapore was they praised the NHS. People recognise that as a model it works. But if you underfund it, run it down so that we have to have emergency plans for evacuating hospitals because they're going to fall down, you can't expect it to be delivering a world-class service.
When the King's Fund says £2 billion a year is wasted by giving patients unnecessary x-rays, that's waste, isn't it?
Yes, absolutely. There are
so
many
when you
areas.
said there's very little waste, respectively, I've just found £2 billion in about a minute and a half.
Okay,
well, I'm glad
let's go. No, I'm not laughing. I'm saying.
And that took me 90 seconds. Can you imagine if I brought in a team of forensic accountants? Can you imagine the waste that we'd find?
I would absolutely welcome bringing in a team of forensic accountants and saying, where can we make the system better? Okay. Nobody thinks you can't make the system better. And everybody would welcome the time to make the system better. But when you're running to keep in place or not go backwards, you can't look at innovation and technology. You're just trying to deal with what's in front of you.
Just lastly on this, Doctor, and obviously you're an expert in the field, I'm not, and you reference the NHS, and many of my listeners, indeed I'm here, thanks to it, but if it's so great, why aren't there similar models elsewhere in the world?
You know, nobody's got the same model around the world.
Well, if you look at France and Australia, there's broadly the same. You pay a certain degree in insurance, but why is there nothing like the NHS anywhere else, do you imagine?
Well, first of all, they spend more money than we do. And secondly, the NHS is it's a great piece of social engineering, which people like.
Well, we sort of want health
If it were restored to funding, if the funding were restored, if Labour would commit to staff retention and recruitment and capacity expanding, the staff would think, thank heavens, we've got somebody coming in who understands what we need.
I will leave there. Thank you very much both for your time and for the work you do as a consultant radiologist. Thank you, Dr. Jacky Davis. You're on the BMA Council and you're a founder member of Keep Our NHS Public. You might have views on that. It's 8:30.